Hi, Violetta.
Hi.
Hi. So, I see you're here for your annual physical exam. So can you confirm your date of birth?
December 30th, 75.
Okay. Great. And what's your level of pain right now on a scale of 1 to 10?
9.
Okay. 9. What's wrong? What's hurting?
Headache.
Headaches. Okay, I'm so sorry to hear that. Do you get headaches often?
Sometimes.
Okay. All right. So do they happen at a certain time of day? Like in the morning or?
Afternoon.
Okay,
More
afternoon.
afternoon.
Okay. Okay. And do you drink coffee?
In the morning.
Okay. And so how many cups of coffee would you
1.
say? 1 cup. Okay. And do you have any insomnia along with the headaches?
No.
Okay. All right. Would you describe it more as a throbbing pain or just like a dull sensation, or is it really sharp?
Dull.
Dull, yeah. Does it throb at all?
Mm-hmm.
A little bit, okay. Okay. So are you taking any medications on a daily basis?
Like regular one.
Okay.
Pylenol.
Okay, great. All right. What about your diet? Are you on any special diets like vegetarian or vegan?
Yes.
Okay, so vegetarian. Okay, and how long have you been on that diet?
1 year.
Okay. So, do you have any family history of hypertension or high blood pressure?
No.
Okay. Do you wear contacts or glasses?
No.
Okay. So you have good vision. Any back problems or joint aches?
No.
All right. Injuries in the last year?
Yes.
Okay. And what happened?
Same.
Yeah. Okay. So did you bump your head at all, or? Okay.
Yes.
All right. All right. Any skin disorders, redness or dryness?
No.
Okay. Okay. I'm going to start by putting on some gloves, and then I'll take your vitals. All right. I'm going to start by listening to your heart and lungs. Okay. So just breathe normally for me. Okay. Sounds are normal. Great, no extraneous noises. Listening on the bell side. Okay. I only hear S1 and S2. No S3 is present, so that's very good. All right, I'm going to be listening to your lungs now. Take a deep breath for me if you can. Great. Okay. And again. Excellent. Next, I'll be taking your blood pressure. Do you have an arm preference? Okay, let me go ahead and use this arm. Okay, I really like your nail color.
Thank you.
Yeah, very pretty. Okay. I'm going to go ahead and give it a listen. All right. That's 110/78, so very, very good. Slide this off. Great. to take your oxygenation and your temperature. So if you could give me your index finger. Here, this one. Very good. Excellent. And temperature. Okay. That's 98.5. Okay. And your heart rate is 72 beats per minute, which is excellent. Oxygenation is 97 percentile at room air. So for the next portion of the exam, I'm going to have you lay down on the bed just so I can have better access to your face and neck and scalp. Then we'll go to the abdomen and to the feet. Okay. All right, so I'm going to go ahead and palpate the face and neck. Okay, you can just relax. You don't have to do anything. Okay. Underneath the eyes for any sinus enlargement, which I don't feel anything. Okay. Alright, I'm just going to do some strengthening tests. So, try to raise your eyebrows. Yes. And if you could try to lower them on the count of 3, I'm going to resist you. 1, 2, 3. Good. Okay. Now if you could try to raise them again, and I'm going to try to pull them down. Very good. Alright. So I'm going to put my fingers on the bridge of your nose. And if you could try to turn your head this way to the right on the count of 3. 1, 2, 3. Very good. And the other side. 1, 2, 3. Good. And do the same thing here. I'll be putting my hand here. 1, 2, 3. Good. And the other side. 1, 2, 3. Very good. Okay. So next I want you to try to touch your chin to your chest on the count of 3. So 1, 2, 3. Very good. Now do the opposite. So try to look up on the count of 3. 1, 2, 3. Excellent. So if you could lift your head just so I can see your hair. Thank you. All right. I'm going to be examining the hairline. Just looking for any lice, dandruff, infestations, any sign of an unhealthy scalp. Okay. Just gonna get a little closer here. See anything, no signs of dandruff. I see a tiny mole here. It looks symmetrical and healthy, but I'm going to take a measurement of it just to have for our records. Okay. Just to keep track of. Okay, very good. So that's a 0.5 millimeter. Just looking a little further here. Okay. Do you shampoo your hair every day?
No.
No, that's very good. It's good to let the natural oils build up so your hair stays healthier. Yeah, your hair is beautiful. I don't see any issues here. And your scalp looks very well perfused. I don't see any signs of dryness, so it's a good sign that you're very hydrated. Okay. I do see some natural bumps on the face, but I'm just going to be scraping this depressor along the face just to make sure the bumps are flush with the skin. Your skin is very healthy. So, I'm going to be giving you two sensations on your face. This will be sharp and this will be dull. So keep your eyes closed and let me know which one you feel. So say sharp or dull.
Sharp.
Very good.
Dull.
Yes.
Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. 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 Dull.
Good.
Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp.
Alright. So I'm just going to palpate the neck. Just feeling along the trachea for any enlargement. No swelling, which is very good. I'm going to be feeling for signs of TMJ. So could you open and close your mouth all the way? Very good. Now close. Okay, no clicking or popping. That's good. Now I'm feeling the jaw alignment, so do the same thing here. Open. Good. Now close. Excellent. All feels very healthy to me. I'm going to go ahead and move on to your abdomen, Violetta. If that's okay. You don't have to move yet. Just letting you know. Okay.
Okay.
All right. I'm going to listen to your stomach. Just listening for any extraneous sounds. Okay. Okay. I hear some stomach gurgling, but that's very normal. Okay. All right, very good. Go ahead and palpate the stomach. Okay, so I'll just be feeling your organs and feeling for any enlargement or anything to be concerned with. But so far, everything's normal. Okay. Just gonna raise this a little bit. There you go. Okay. Okay, your liver and your spleen feel normal. Sorry about the pressure here, but it's just necessary to get an accurate reading. Okay. All right. Very good. All right, I'm just going to do some percussion, so just making sure the sounds and vibrations come back. Okay. Okay. Was there any pain when I did that?
No.
Okay, that's very good. All right, I'm just going to be taking some measurements of the stomach, okay? 30. Okay. The lateral side, okay. 32. Well, within the normal range. So 22 is the last one. 20. Okay. All right. I'm just going to examine the skin a little closer here. Okay. Okay. Pores look normal. I don't see any signs of irritation. So that's very good. Just some very minuscule freckles. I don't see any moles. Okay. All right. Excellent. So, I'm going to do a sensations test. All right. So you're going to feel either warm or cold. This will be warm, and this will be cold. Okay.
Okay.
All right. So tell me which one you feel.
Warm.
Good.
Cold.
Yes.
Warm.
Mm-hmm.
Cold. Cold. Warm. Cold. Cold.
Yes.
Warm. Cold. Cold. Warm. warm, warm, cold, 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 warm,
Okay,
warm.
great. Okay. So your stomach and head all feel normal. What I'd like to do next is just look at your back and the back of your head. So I'm going to flip you over and be looking at your back, okay?
Okay.
Great. All right, and with your permission, I'm going to go ahead and lift the shirt just so I can have better access to your spine. That's very perfect. Okay, and again, just like with your stomach, I'm going to listen to the back. Okay. Could you take a few deep breaths for me? Good. All right, again. Good. All right, and you can breathe normally. Very good. I'm going to be feeling along the spine just for signs of scoliosis or any abnormal curvatures. So I'll just be palpating and just squeezing right here. Okay. Very good. Okay. Right. I'm going to be just pinching the skin very lightly just to measure for normal refill to test for circulation. 2.5-second refill. Yes. Okay. Okay, so your circulation is excellent. I'm just going to test your vibrational sensations of the spine, looking for signs of any numbness or loss of sensitivity. So I'm going to be using a tuning fork. You're going to feel a vibration on your spine, and when I stop the vibration, when you feel it stopped, say stop, okay? All right. Thank you. Yes. Okay. Yes. Excellent. Okay. Again, I'm going to be scraping just to make sure the bumps are flush with the skin, so you don't have to do anything, just relax. Okay. Okay. You have extremely well perfused skin. Very good. All right. So, all right. So, we're going to do another sensations test. This time, it's going to be wet or dry. So when you feel this, you're going to say wet, and then this will be dry. Okay? All right.
Dry.
Good.
Wet.
Good.
Dry.
Yes.
Wet.
Excellent.
Wet.
Good.
Dry. Dry. Wet. 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 Dry.
Good.
Wet. Dry. Wet. Wet. Dry.
Excellent. Okay. So you can stay laying down. I'm just going to be examining your feet next, but so far everything's very normal.
Okay.
Okay. I'm going to test your babinsky response. Okay. So the skin of your feet look very healthy. Some slight dryness, but that's something that all of us get. I don't see any fungus. No warts or lesions. No blisters. A large indicator of a lot of health problems is swelling of the feet. So I'm going to go ahead and take some measurements just to make sure that they're symmetric and there's no swelling. That's 2 to 5. Okay. Exactly the same. This is 2.5 inches here. Okay. This is 5 3/4. Okay. Great. Excellent. I'm going to be applying some slight pressure to your toes. I want you to tell me which foot you feel it on, your right or left, okay?
Right.
Good.
Left. Left. left, right, 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 left, right, left, left, left. Both?
Yes. Good. Very good. And just examining the sensations of your feet. I'm going to be doing, it'll be just like the sharp and dull and the cold and the wet and the dry, but this time it's going to be hard and soft. So this will be a hard sensation and this will be soft, okay?
Okay.
All right.
Hard,
Yes.
soft,
Mm-hmm.
soft, soft, hard, soft, soft, soft.
Okay.
Hard,
Yes.
soft, 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 hard, soft.
Okay. Very good. All right, Violetta, everything came back normal, so you're very healthy and good to go for another year. I didn't see anything in your cranial nerve exam that would indicate anything serious with your head, but I'm going to go ahead and prescribe you on a low dosage of ibuprofen, 200 milligrams to take as needed. And of course, I'm going to order a CT scan so we can just scan the area, make sure there's nothing underlying, okay?
Okay.
All right, so I'm going to schedule that for you for in 2 weeks. Do you have time?
Yes.
At the same time in the afternoon? Okay, and we'll give you a call to follow up about the exact address and location. Other than that, do you have any other concerns or questions?
No.
All right, thank you so much for allowing me to do this exam, and we'll see you back again next year then.
Thank you.
All right, great.
See you.
Bye.